song choice.
Thank you.
Why Hamilton?
Welcome back.
Thank you. It's a big question. I have a debate with myself right now in terms of like the most influential people in the world, and or that have ever lived. And he's certainly in the top 3, top 4 of my debate. And his story is just such an extraordinary story from birth to death. And I think every song on the soundtrack resonates with me in some way. And it's the only soundtrack I've ever had that I've never gotten tired of.
Yeah.
So whether I'm running, cycling, deadlifting, whatever it is, it seems to always be an appropriate music choice. So why not? Why not for the walkout?
That's me for the Wicked soundtrack. Never get tired of it. All right, well, this is going to be fun. New location, new host. Let me introduce myself for those of you who don't know me. I'm Sarah. I'm one of the leaders here at Baker Health. Today I have really big shoes to fill, but the absolute pleasure to be here with our guest, Steve Forti, who I'll introduce in just a second. But before we get into the main reason why we're all here tonight, I'll go over a couple of housekeeping details. One, we have yoga classes going on all weekend long, so make sure you register, sign up, head on over. We have Edgewater on Saturday, Moonaki and Clifton on Sunday, so sign up if you haven't. And our second one, which is an exciting one, we have an app, I think I told you that. A new update got released earlier this week. And this update is really cool, actually. You can now schedule your vitamin infusions, weight loss injections, and all other injections right through the app. So if you haven't downloaded that, make sure you go ahead and do so. All right, so let's get started.
All right.
So Steve here has a very interesting journey, motivational, actually. We were just going into it, and there's a lot. So I'm excited to get into it. He is currently the Chief Wellness and Resiliency Officer at HSS. HSS is the #1 ranked hospital in the United States for special surgeries, right?
Correct. Yeah, #1 musculoskeletal hospital in the world.
That's crazy. That's awesome. So tell us a little bit about your journey, what you do exactly, how you got to where you are.
Sure. Well, first, thank you for having me here. I'm really excited to have this discussion. The facility here is amazing, by the way, truly. So I currently have the absolute privilege of serving as the Chief Wellness and Resiliency Officer. And I get to work with an extraordinary group of individuals and a team at HSS under new leadership with Dr. Brian Kelly, who's an extraordinary human who has an amazing journey himself to tell. I get to play, and I say this humbly, a supporting role in being in proximity to the provision of extraordinary care. And
That's a great way to put it.
Yeah, and what's amazing about the Hospital for Special Surgery is wherever you go, you tend to run into someone that didn't just have a good experience with HSS, but had a extraordinary, life-changing, phenomenal experience.
It's like our members here at Baker Health.
I can see that as I look around here. It's HSS is a 163-year-old brand, and it has been doing things right for a very long time. So I'm very proud at this point in my life to be in proximity to it or to be supporting it in some way. I have very little to do with the extraordinary brand and reputation and stories that they have, but I still take a great deal of pride in being a part of it right now. I serve as the Chief Wellness and Resiliency Officer, and I'm responsible for all of the programming and the things to keep the staff well. And well is it's a big word. It's a broad word, and it encompasses a lot of aspects. But I get to play a role in developing the programs to keep people as healthy as they can.
Now, is it the patients or the employees of HSS?
It's the employees. So I don't have any direct patient contact. I used to in previous lines of work, but right now my job, and I say this very humbly, is to support those that provide it. So it's basically keeping the force fit in a number of different ways so they can handle the 36,000 plus elective surgical procedures, mostly elective procedures that take place on an annual basis.
That's awesome. And now HSS is primarily in New York, Connecticut, and you guys just opened recently in New Jersey.
Correct. We're in Jersey and also in Florida now.
Oh, nice.
So we're expanding our footprint, and patients across the country are feeling the benefit of that 163 years of experience in the musculoskeletal space. So we're continuing to expand. We have an aggressive strategy over the next 10 years to be able to impact more and more lives in that musculoskeletal space.
That's awesome. So being a hospital only for special surgery is so unique.
It is, and it comes with some interesting dynamics to it because it's not narrow in scope, right? Musculoskeletal health is a huge discipline and practice. We also have a very highly ranked rheumatology division, I guess, or department, for lack of a better word, and we have a very sophisticated research arm as well. So we do a lot for what we are, and we're tied to innovation. We're tied to a bunch of different partner hospitals. We have an incredible residency and fellowship program across all musculoskeletal disciplines. So we have a web that sort of reaches into, I would argue, probably every single hospital across the country, and then the world.
Right.
We have a presence throughout throughout the world.
That's awesome. That's awesome. Now, the most important and the most interesting part about people is their journey and how they got to where they were. So can you tell us a little bit about yours?
Yeah,
We'll be here for a while, but
we're going to be here for a while. It's
a good one.
It's not a direct journey by any stretch, but it's sort of a bunch of things falling into the right place for a time such as this. If it's all right, I'm going to cover some personal stuff on this podcast because clinically I'm not that interesting. So I guess my journey started really. The thing that brought me here was, at the age of 19, my father passed away from non-Hodgkin's lymphoma. He was a Vietnam veteran, and he died from cancer from Agent Orange. His case was actually the first one that was directly attributed to Agent Orange, which was a pretty important thing. And there was a bunch of interesting stuff that, happened throughout my journey and my family's journey. One of the most important things was my grandmother was the CEO of Sikorsky's, personal secretary at the time. And the military and the industry tie-in to the Vietnam War and Sikorsky, where my grandmother worked, played a huge role in him surviving being blown up in Da Nang, essentially, is what happened to him. And he received excellent care and was evacuated back here to the United States, and he survived his injuries, and then went on to be with my mother and to have me and get a college degree and live a short but productive life. Like I said, he passed away at 40, and I was a freshman in college, and it was at that time that I had my first sort of adult wake-up call where, and I was joking with you before the show, where it's like, the bursar's office was like, you need to actually pay for the colleges that you want to attend.
You can't just come here.
Yeah, you can't. This is not a pro bono organization per se. And that's what drove me into the military and, led to my path to going into Special Forces and becoming a Green Beret.
So what did you go to college initially for?
Initially, it was like general studies. I was, let me be clear, I was far from a rock star student. I went to Northeastern primarily because I could get in and because my brother was there. My brother was there because he was chosen to be there. He did very well academically, and it was just sort of an easy, convenient choice for me. So I wasn't getting it done by any stretch, so it was probably best that I, initiated or had a pause initiated in my life. I had this lack of direction. I wanted to do good in the world. I didn't know what that looked like. I wanted to be somebody to be taken seriously, and I didn't really know what that looked like. So the Army provided a good reset for me, and then thankfully in the Special Operations community, a handful of slightly older men that were willing to invest time in mentoring me and I would say keeping me out of trouble, truly.
Keeping you in line.
100%. So it was that, chemistry that really, really helped me at that point in my life want to be more than, the direction that I was headed. Helped me define myself a bit. So I was in Special Operations for about 10 years. And, another tragedy would befall my family. My mother would suffer from an acute alcohol intoxication. in 2001, right after 9/11, actually, right before 9/11, and she died. And I remember seeing the team at the hospital giving her extraordinary care, from when they were trying to save her life to the palliative care,
Right.
when they were just recognizing like she wasn't going to make it. She had a traumatic brain issue and it wasn't going to go well. So we gave it 72 hours and took her off life support. I might have been 48. I don't really remember. The whole thing's a bit of a blur. But when I saw the team taking care of her, I didn't know specifically. I didn't know much about medicine, but I did know that I wanted to be in proximity to it in some way. So I began doing my research, and I identified a path of going to medical school. And the quickest way for me to do meaningful things in medicine was actually a Bachelor of Science in Nursing at Quinnipiac University. So I applied and was accepted into that. Actually, I applied while I was in Kuwait, deployed with the Army.
Oh, wow.
And was accepted right when I got back and redeployed. And I would start a 13-month Bachelor of Science in Nursing. Did a critical care residency at Yale.
So nursing into medical school.
Well, that was my hope. That was my plan. So we could look at it as, at the time, I needed 900 patient contact hours.
Right.
And I needed some type of volunteer or exposure in medicine in order to even apply. And it was like I could get my 900 hours from my clinical time, getting my BSN, and I would have a license. And if I didn't get into medical school right away, the thought was, well, at least I'm in medicine as I'm applying and contributing to the direction of medicine and building a resume for myself.
Right.
So I did that.
Smart.
It didn't work out. It didn't work out in terms of the plan, but we always say like the first thing to go in the plan is the plan itself.
Yeah.
So I enjoyed being a nurse. I did a critical care residency at Yale, and then worked at Bridgeport Hospital's emergency room, which is a level 1 trauma center. And then I worked in some more community-based emergency room nursing. And I did that for 8 years. And you get to see a lot of interesting stuff.
Oh, I'm sure.
Yeah. I worked at Greenwich Hospital's emergency room in Bridgeport, and the contrast in the population, even though the problems are the same, just to see and compare and contrast those patient populations was interesting.
Yeah. So I always knew growing up that I belonged in healthcare. It's my passion. It was only, for me, I thought that looked like being a provider, right? So being the one who's diagnosing, being the provider. Didn't know if I was doctor, PA, whatever, even nurse. It was only a couple months ago where I discovered that, yes, healthcare is my passion, but more so the administrative side, not so much the clinical side. So how did you make that decision? How did you go from clinical to administrative to where you are now?
Yeah, the decision was kind of made for me. Right? None of my life, I always joke that like I plan no more than 30 minutes out, right? But in that 30 minutes, I try to do good work. And so I never planned on like, I'm going to be a provider or I'm not going to be a provider or I'm going to transition into administrative. What happened with me was I had gone back into the military in 2008. A friend of mine asked me if I would go back with him to Afghanistan. Well, what happened, he came and met with me, said he was taking a team to Afghanistan, and he said, do you remember when you and I were at the Pelham? And you said if I was ever taking, Pelham is a bar in Newport, Rhode Island, for those that don't know. And he said, remember you said if I was ever taking a team to Afghanistan, you'd re-enlist and go with me. And I said, sounds like something that I would say at the Pelham, sort of implying that we'd be drinking at the time, love you, bro. And but it sounded like something I would say, and it sounded like something I wanted to do, and I did want to go do my part in Afghanistan. I hadn't served.
You kept your word.
I kept my word, I think.
Or alleged
what
word.
We think is my word. And I enlisted and went back in the Army and began a series of different training iterations. And I deployed to Afghanistan in 2009, for most of 2009, and then redeployed and I reclassed into the intelligence side of things.
This was after nursing school.
Yeah, after nursing school and after an 8-year nursing career.
Wow.
So I departed thinking I would go back to nursing.
Right.
Like it was just that I was going to deploy for a couple years and then I
Come
would
back and
come
pick
back,
up the
yeah,
same.
and possibly come back and apply to medical school or do nurse practitioner or PA school, something. I'm not one to stick with one thing for a long time. In case we're picking up on a pattern here, and so I began and up until about 2015 would continue to be actively involved in the special operations community. I got involved in the intelligence side of things. I got to take some really interesting paths within the intelligence community. And then in 2015, I would get off active duty and kind of reset and start determining what my path was going to be in the civilian side of things again. And then if we jump to 2020, I would get a call from a very dear friend of mine that I had done some work with years before, named John Englehart. Brilliant guy. He's the chief marketing and communications officer at HSS. Oh. And he's one of the kindest, most intelligent people you ever meet in your life. And COVID was starting to happen.
Right.
This was in March.
So I think pre-pandemic.
Yeah, well, it was like March 22nd of 2020 when I reached out. So eminent hospitals were getting hit, and HSS had made the decision to shut down its elective procedures and convert the hospital into a COVID treatment facility, essentially, to try to help decant the exponential growth of sick patients we were seeing in the New York City area, right, to do its part. And I didn't know anything about HSS, truly. I'd been a patient at HSS, had my knee done, and had great results, but I didn't know the history. I didn't know the people. I had no tie to it. But it was sort of this I want to be a part of people that are willing to do this hard thing, I've always been more comfortable being surrounded by people willing to do the hard thing, and excited by it. And here it was this opportunity that I had only previously found in the military, right? Like people getting on a plane to go to war. This was people mounting up locally to go to war against COVID. So the first call I got, I think, was March 22nd or 27th of 2020. And then on April 1st, I was driving into the city, and I had agreed to come on board for 90 days to do crisis management.
Got it.
And, the quote was basically we didn't know exactly what we were going to have you do.
But we're just going to have you do it.
But we think you might be better off if you're here as a teammate of ours. And I say that humbly, and I felt the same way.
Right.
I actually felt lucky at a time to feel valued and to be able to do something proactive as we saw this sort of COVID train coming down the tracks.
That's great. That's awesome.
Yeah. And then after there for about 90 days, Lou Shapiro, the previous CEO, who's a fantastic leader, extraordinary businessman, had asked me to come on board and join the
wellness team?
Yeah, well, form the wellness team.
Oh.
So,
So it didn't exist before you were on board?
No, and HSS was among the first. Very few hospitals in the area had a chief wellness officer.
Right.
Wellness was more something where they talked about take care of yourself before you take care of others, and take your vacation time and all these things. But it kind of got down to, what the hell does that mean? What does it mean?
Can you explain what it means?
Yeah, so I could explain easily what it sort of historically has meant, and it was this idea that you're going to take care of yourself, and you're going to take your vacation time, and you're going to take moments to yourself.
Yeah.
The old adage that I can't stand is put the oxygen mask on yourself before you put it on others. And I get the sentiment, but it's okay, well, what does that mean? So we've defined it very clearly at HSS, and some of that was informed, most of it, I think, was informed by my experience in the military. So if we could step back, I want to talk to you a little bit about what we saw in the special operations community and the military. We've all seen the commercials and heard the news about 22 veteran suicides a day, right? Which is horrific, and that's probably true and accurate, up and down over a sine wave. And we know that people that were in this, unbelievable, relentless operational tempo from the onset of the first war against terror in 2001, right? And then it spanned a great deal of time, and we saw a real impact of burnout, real. If you compare it to medicine right now, where medicine has a suicide rate, depending on if you're looking at men or women, somewhere between 40 and 42 people per 100,000, right? Well, what's acceptable? Zero. Right? No one should take their own life, right? But we know that people who are in a service role take their jobs, successes and failures, a little harder, and that plays into the challenge of healthcare and other service-oriented professions. Right. So special operations community had a suicide rate of about 63 per 100,000.
Wow.
Horrible. And you're talking about a community that's so much smaller than medicine,
Right.
right? Like, I mean, Navy SEALs, I think, there's 4,500, Green Berets, there might be 9,000, like, depending. So you're talking about a very small community with a very high rate of things like suicide. And then it gets even worse when you look into, like, substance abuse and misuse, insomnia, health things
Yeah.
such as, like, type 2 prediabetes, like elevated hemoglobin A1C,
Physical health and mental health.
all of it. And, the damage for the family and the family unit, the things people don't talk about with sexual intimacy and, family presence,
Right.
all of these things. So the community was feeling the weight of this operational tempo. And what I can tell you is, having witnessed it, been in proximity to it in the special operations community, and seeing what that's done over the past 15 years to people I care about, you could see that starting to raise its ugly head in medicine.
Right.
I know I've been on a 30-minute run-on sentence here, and I apologize.
No, it's awesome.
But so what we do is, we define wellness at HSS as basically to make you safer while you're here and stronger as you leave. That's the one-liner. That's the elevator pitch, right?
Right.
Well, what does that mean? We are living in a incredibly upregulated world. We are all upregulated. We are all in a state of hypervigilance.
Right.
We are constantly hit by stimulation from a million different things. And whether that's social media, whether it's work, whether it's life, whether it's stress, all right, in the military and in industry, they call it allostatic load. It's the entirety of your environment working against your health.
Right.
At HSS, we seek to offset that, to mitigate it and fight against it.
And that's part of your title, right? So it's not only the wellness, but it's the resiliency.
Correct.
And to be resilient is to overcome adversity.
Yeah. And what happens is, if you provide people with the tools and you let them know they're seen and you provide them with the appropriate leadership, trauma, challenge become growth opportunities.
That's true.
But in the absence of that, they become damaging, detrimental effects. So what we seek to do at wellness, at HSS, is to mitigate the damaging effects of that environmental things that we can't change.
Now, how do you guys do that? What certain programs can you talk about that are in place for the employees?
Yeah. So we have a lot, and I think very few organizations have as much as we are able to provide. So it's important to understand, how HSS is laid out. And we talked about it's an enterprise that spans a great distance. So one of the things we seek to do is have programs that are put in place that are accessible to everyone. We want to meet people where they are. So whether they're a registered nurse down in our Florida campus, or whether they're a scrub tech on HSS Maine, or a PA in Stanford, that they generally have access to all the same resources to help mitigate that allostatic load. So great thing about technology is you can purchase access for things like Peloton, right, for the fitness piece of it. We have Headspace as our EAP, or mental health provider, or one of our mental health providers. So these are two resources that are available, okay, to everyone in the enterprise. Additionally, we have a sleep coach that we contracted, okay, who teaches a curriculum.
That's important, especially for all the overnights that healthcare does.
So damaging. And people, generally speaking, like insomnia rates in healthcare, whether you're looking at nurses, paramedics, scrub techs, or whatever, the insomnia rates for MDs are so much higher. And if you look at the worst case scenario, which we talk about, which is suicide, most people that take their own life in medicine have a documented history of insomnia in their chart, usually within the last 6 months.
Wow.
So, we address that insomnia piece through a sleep human, a person that teaches classes. I actually wrote a curriculum on a course that we teach called Mind Mastery, where it goes into how do we focus on the things on our daily basis, like light exposure, nutrition, hydration, sleep hygiene, tech hygiene, light discipline.
Tech hygiene is a big one.
Huge.
Now that everyone's so tech-enabled, tech-focused.
It's so detrimental. If your goal is to stay down-regulated and relaxed, I don't think tech is a worse choice. In particular, we're seeing it. I mean, you see it in our nation's youth. Right
Yeah.
now. You know, the social
Oh,
media
yeah.
piece is horrific. You know, it's not just the screen time, but it's what's the screen time behind
Yeah,
it.
what you're consuming and what you're getting out of it.
Horrible. So, you know, Andrew Huberman, who's brilliant, said, made a quote on, was quoted on Rogan podcast, where he said something to the effect of like, he doesn't believe that we have a health problem in the country, we have an education problem. A lot of people are good intentioned, they're disciplined, but there's so much garbage information out there. You know, what do I do to live a healthier life? Right? Like even if you talk about like the subject of weight loss, right? People like carnivore, keto, right? Carb-free, restricted carb, intermittent fasting, 1 meal a day. Like there's a million different things that everybody's an expert on. And actually most of the people that are espousing these things aren't experts in any of them, have no clinical background. So the overarching thing that we do at HSS is every single thing that we focus on is peer-reviewed research, indisputable. None of it is
Coming from the experts.
yeah, none of it's speculative. Like it's, you know, insomnia is something that has to be handled and tackled, and we have to increase the sleep. We've even gone as far to run a few pilots at HSS where we put a wearable on. We got a wearable on about 1,300 staff members, and we provide them with a coach to improve these critical measures, to improve their lifespan and improve their health span.
It's awesome. So where do you think, or at Baker Health, how do you think a position like yours would positively impact us?
Yeah. Well, I don't want to speak out of turn because it seems like you guys are doing an extraordinary amount for people here in the world. So if I say anything that is obvious and inherent to what you do.
We have a very holistic approach, and we focus on overall wellness too for our members. So I think we do a good job at ourselves for them, but you know, for internally, like for the team.
Well, you got me on board when you started talking about, you know, on the intro where you started talking about yoga classes and the community and the education piece. Now, obviously, yoga is one of the levers we can pull, right? Well, why is yoga important for people? Well, there's a human performance element, right? There's a structural, musculoskeletal benefit to it. But overwhelmingly, the benefit that comes from something like yoga is this topic I talk about, this autonomic downregulation, right? So you're already off to a good start with just the intro, the fact that you focus on something to get people out of this state of hypervigilance. And I think there should be a role. And one of the interesting things that, you know, you see, because you have a pediatric and an adult population, right? It's never too early to start talking to people about these really important topics like sleep hygiene, breath work, gratitude, forgiveness, all of these really critical topics that have to be addressed. These aren't nice to haves anymore.
It's a must.
Autonomic downregulation, this idea of untriggering, downregulating, chilling out, whatever term you want to put to it, has, not doing it, has significant physiologic consequence. And they see that in elevated blood sugars. They see it in insomnia. They see it in substance abuse and misuse.
That's like we always say, prevention, it's over the cure. So
100%.
preventing yourself in those aspects.
Yeah. And it's time under tension, right? So if you're living a life of hypervigilance, and if you don't start addressing it, like it's never too late to start addressing it, but the difference between addressing it at 14 or 15 years old, teaching children to take a moment, teaching people breath work. And you can pick your breath work. It doesn't matter whether it's box breathing or resonant breathing, which is also known as yogic breathing. Whatever that thing is you choose to employ as a lever to pull against the rest of everything pushing down on you is important if you're 10, 15, 20, or 50.
All ages.
All.
I have a million more questions, but let's get into our questions from the members. Infused with our yoga, we actually have meditation. So you said a lot about breath work. It all plays a role.
It does.
So the first question we have, this is a good one, and it brings it back to the military background. Someone asked, what unique challenges do veterans face regarding their physical and mental health, and how do you address them at the hospital for special surgery?
Yeah. So, I mean, the challenges, I think, are unique. Because if you look at the job itself, and I can speak specifically to, like, the combat arms piece, there is nothing worse for you musculoskeletally than wearing body armor. right? Our first responders, our police have to deal with it. You're talking about weight. You're talking about in vehicles. Like, it is really bad for you to wear body armor, okay? The environmental insult alone, a combat environment or a combat theater is inherently sleep deprived, right? And you can't help but see the look on the faces of somebody post-deployment, pre and post-deployment. Like, I aged significantly in an 8-month period of time, 100%.
Yeah.
And it's just the weather, it's the stress, it's the strain. And very candidly, I didn't have the tools then to equip myself to offset some of that allostatic load, that stress and strain. So, and then you come back and you have a overtaxed system. Now, personally, from my experience, I think the VA's gotten a bad name. Like, the VA has taken a beating, and I know that they've earned it and deserved it in many ways, to include when my father was a patient there in the 1960s. But I actually got really good care, and I had a few bumps and bruises. I herniated L3, L4, S1 when I was in Afghanistan. I've had multiple surgeries on my right knee. I had
one of them at HSS.
Yeah, one of them, correct. Injury Afghanistan, but treated at HSS. So, you cannot underestimate the toxic environment that soldiers live in. But what needs to be done is they need to be treating the whole of the person like you're doing here. And I think we treat the whole of the person at HSS, certainly within the context of movement and mobility, right, to the best that we can. When you're treating any soldier population, like, the mind and the heart needs to be addressed right along with any injury that they come in.
Right.
And
we
I
always
think,
say the mind and the body.
Yeah, and I think HSS does a really good job at looking at that. Additionally, I personally have been the beneficiary of being referred to other specialists in other areas through the physicians and physician network at HSS. So it's, while we're number one in orthopedics, we do focus on the totality of the individual, because our goal is to get people back to doing the things that they love. And isn't that, at the end of the day, what life's really about,
What's the point if you're not doing the things that you love?
And HSS, recently has really taken a hard look at the veteran population, has been taking steps in that direction in terms of serving the veteran population, and that makes me even more proud to work at the organization. Yeah.
That's awesome.
More to come on that. But
yeah.
I'm confident.
Can't wait to hear more.
Next question we had, someone asked, what does a typical day look like for you in your role as a chief wellness officer?
Yeah.
You're in New York, right?
I am. And I work out of the main office in the Upper East Side. So a commute, of course, is part of it. But really, there's several different components to being a wellness officer at any institution. And our job is to deload the institution, okay? So some of that is bringing in different vendors to help that. Some of it is bringing in educational piece. It's monitoring all the programs that are put in place, right? But also constantly surveying to get a pulse on the staff population. Like, what's going on in their lives? What are their stressors, and what could be mitigates? There's two different lines of effort. I mean, there's a bunch of sublines of effort, but we work in two different things. One, you work on the industrial side. Okay. So on the industrial side, it could be something like, electronic med records and how patient flow, or how the electronic health records or educational compliance and thing like that increase the stress and strain of the environment. So that's one. But then the easier thing to work on and the quickest thing to turn is on the individuals, right? So we spend most of our time working to get individuals educated, and then to make room for individuals to take those necessary steps for the betterment of their own health within the walls of the institution.
Now, are those like programs and community events, or more so like courses?
So both. You can't underestimate the power of belonging and community. We have very active ERG groups, employee resource groups within HSS for all different subsets of the population, and they do a fantastic job keeping an eye on the wellness aspects, and we support their efforts in those spaces. And I'm proud of the individuals that have stepped up and done that on their own time on a volunteer basis. So I would say that, the most powerful force for wellness at HSS right now, arguably, is in the support of those efforts.
Right.
Now, HSS has the different sporting events, the communities, the races, the runs, the different things that we do and support together. And then there's also the international causes that we participate. Everything from, we provide musculoskeletal care to everyone in an apolitical manner. It doesn't matter. If there is a humanitarian crisis in the world, HSS tends to be involved in some capacity.
Wow, I didn't know that.
Try to. Well, sometimes it's putting people on the ground, and I haven't had the privilege of doing that. And, by putting people on the ground, I say, doctors and teams that volunteer to go
Right.
to different places that have had some challenges and difficulties. And sometimes it's the provision of different materials that we're able to donate. But we always have a very active eye on world events.
That's awesome.
And that gives
It's
people
important.
an incredible sense of belonging.
Yeah.
Nice. Awesome. This is a good question. Someone asked, what personal habits or practices do you prioritize to maintain your own wellness amidst all the demands of your role?
It was a fantastic question. Who wrote that one? You should give their name a shout out. It's a fantastic
I'll go
question.
next.
Yeah. So, one of the things I think, sleep hygiene, well, a couple things. Sleep hygiene for me is a big one. The other one for me personally is sobriety. Okay. I come from a long line of drinkers, and alcohol doesn't work for the Forti family. We've got a history of it not working out. So I made the conscious decision without any drama or incident 9 years ago to stop drinking. And it was one of the better decisions I've ever made.
9 years sober.
9 years sober.
Good for you.
And it's always weird to hear it as like sober, right?
Right.
Like every time I hear it, I'm like, but that's for drunks. But
Right.
it's not. It's for me. And I don't know to what degree alcohol wasn't going to work out for me, but I knew I wasn't willing to take the chance on
right.
it.
You didn't want to find out.
No. So for me, sobriety is one. If people want to do one thing, if they want to take a step in the direction of health and they're drinking, stop. Okay? Or moderate, decrease, do something. But you'll never be healthy and you'll never be fulfilled and you'll never be downregulated with the daily consumption of alcohol. It's not possible. And
Takes away a lot.
it takes away a lot. And if you're interested in human performance, like you could say to me, like, I function very well on a couple glasses of wine every night. And I might even agree with you that you do. But you're not going to sell me on your functioning at a level
Right.
as high as you possibly can.
You're not at your capacity.
No. So if you look at alcohol has a damaging effect to sleep hygiene, right? So sleep hygiene is critical for me. And then breath work. And there's a reason why I like breath work. And again, moderate exercise. No one gets a vote on how you breathe, right? Like life, kids, work might get a vote on how you sleep,
Yeah.
right? No one gets a vote on how you're going to breathe. And study after study, you talk about yoga, and I mentioned yogic breathing, or also known as resonant breathing. Something like 2,600 peer-reviewed papers have been written about the benefit of it.
Wow.
And when people are like, well, I'm too busy, where am I going to find? There's been multiple papers that say under 10 minutes of breathing is more than sufficient to impact your nervous system, your
Right.
sympathetic nervous system, and
Right.
get you out of fight or flight, right? So can we all find 3 2-minute blocks of time to do breath work on every day? 100%.
Absolutely.
And for people that say, well, I don't have time to do it, I'm too busy, great, because I got the perfect solution. Yogic breathing has been proven to be more effective when paired with another activity. So on your slow walk to the parking garage or on your
Focus on
ride on
breathing.
the train, focus on your breathing, and we can all do 5 seconds in, 5 seconds out.
That's
We
all
all
it takes.
have that. That's all it takes. And if you can do that for 2 minutes 3 times a day, and you have a wearable, you will see the dramatic impact that has on your sleep depth and duration, your resting heart rate, and your heart rate variability.
Our
a good
yoga
tip,
instructor, she said yes, yoga and breath work.
100%.
She's the best. Final question I think I have, unless Sarah, you have any more, or if the viewers have any more. This is a good one. Someone asked, what's one piece of advice for everyone watching to maintain their overall wellness?
If I only get one, I mean, I already said the drinking thing, right? But
I have one.
we're power. Please.
Do something you love every single day.
That's a good one if you can find it. I think what I would want to say to these people is, like, you are powerful people in the end state of your lifespan and your health span, right? We live in a society right now where people are taught that, like, what's ... going to do, right? Like, what's breath work going to do for me?
Right.
I've got a sick parent, right? I've got a child suffering with drug addiction. Like, what is breath work going to do for me? What is moderate exercise going to do for me? And the answer is everything, right? There's a study, let's not get into studies, but when you're in an upregulated state, you're going to miss a lot, right? Has anybody here ever had an argument with someone they cared about where the topic is who's not listening to each other more?
Yeah.
Yeah.
You're not listening, right?
100%.
Like everybody has had that argument. And the thing is, you're both right as you're living that life because you're both in this state of upregulation, this state of hypervigilance. And when you're in this state of hypervigilance, whether it's for your pet, your significant other, your child, your parent, presence is key. Hearing what you need to hear, seeing what you need to see. And you're not going to do that. So any step that takes you towards downregulation, if there's one thing, I got to tell you, I would have to say that it's the alcohol piece.
It's sobriety.
It's everywhere, or at least moderation, or at least strategy. You know, we live in a time right now where alcohol is universally available, right? The prices are set so everyone can afford it.
Yeah.
It's universally damaging to everyone that consumes it. Might have some good times about it, but it comes with a hangover.
Right.
It comes at a physiologic cost. You don't feel it as much when you're 22 as you do when you're 35 or 50. I don't know about 50. I can tell you at 42 I had some rough mornings. But I would say that sobriety would be a thing. Now, if sobriety is not the thing that you're going to focus on, then you would have to say it's sleep. And if you read like Matt Walker's book, Science of Sleep or Why We Sleep, or if you look at these things, right? If you focus just on sleep and sleep hygiene, you're going to notice that things like alcohol or not exercising or not having outdoor exposure are going to negatively affect that.
It's always so interesting because like every guest we have, they always bring back to like the same thing. It's always the same like kind of three things, like sleep hygiene, your diet, and exercising.
Yeah.
So it's always really like, I mean, should be a wake up call to everyone.
And every one of these things, really what it's acting on is the state of self-regulation, right? Like sleep in support of self-regulation. Exercise is good. CrossFit 6 times a week, not so much. I used to be the guy that thought I needed a sweat angel on the ground to think that I worked out sufficiently. And if I didn't, then I would make sure I got there somehow. But the reality is we need outdoor activity. We need moderate exercise a hell of a lot more than we need intense exercise. And that's in support of sleep.
100%. I don't have any more questions. Sarah, if you have.
All right. I think you answered all mine.
Fantastic.
This was fun.
That quick.
This was
Yeah.
excellent.
And I can't thank you enough for having me.
Thank you for coming.
I hope everyone tolerates my 30-minute run-on.
No, you're
That's
excellent.
great.
We need to do this again in our podcast room at Z's house one night.
I'm happy to, and I look forward to it. And I'm really, I just have to say, I didn't know what I was walking into here. And after I took a quick tour of the facility, if I could tell the listeners, if they're not familiar with it, they should come here and see the way you all are doing medicine, because it's innovative and it's important that the entirety of the person is considered. So
100%. And you have your own podcast, right?
no, but I've been toying with the idea. I've been on a bunch of podcasts, and the message of sobriety that I keep talking about seems to keep coming up. So I'm building up the courage to pull the trigger on that. So
If you ever do, let us know. We'll definitely
You can
love
have
to.
me on as a guest.
I would appreciate that very much.
Thank you so much, Steve.
Thank you for having me.